revolution.
Are we on the air?
Yes, you are.
Live from the studios in Barcelona, Spain.
Please welcome.
It's Slade Suter Live on Authenticity Radio.
Thank you very much.
Where the honesty is refreshing, phoniness out of style, and the only thing available on today's menu is the freedom to express who you truly are.
That is what they do.
This is Authenticity Radio.
Hey, welcome. Grab a seat anywhere. No, we don't have any menus. The only thing we have today is the freedom to express who you truly are. We call it Authenticity Radio. You'll like it, don't worry. Let me go grab the host. He's got the hospitality of a fat and jolly innkeeper. He's a good guy. Slade Suter.
And thank you very much. Thank you for joining us on today's morning edition on Authenticity Radio. Today, we have Dr. Lisa Price, who is an author, a naturopath doctor, and a research scientist. She joins us all the way from Washington, so we're kind of like bouncing clear across the world. So, Dr. Lisa Price, welcome to Authenticity Radio.
Thank you so much. I'm very honored to be here, Slade.
I'm very excited to talk to you because I am so full of questions, as well as so many of our listeners. Today's subject is naturopathic medicine and how Western medicine has been making strides in working alongside naturopathic remedies and naturopathic medicine.
Yeah, and that's a really interesting and progressive way of that's actually exploding right now. I'm so excited about that.
And you are on the cutting edge of this. Am I correct?
Yeah, I would say so. So I'm a licensed naturopathic doctor, and I have a specialty in complementary cancer care. So what that means is that in the state of Washington, it's illegal for naturopaths to treat cancer, but what we do provide is complementary cancer care. We can provide that. And so we work alongside oncologists and oncology radiologists, etc., to provide a kind of a team approach for cancer patients. So all that to say is that most of the, I would actually say most of the progress has actually come in oncology or cancer treatment with regards to integrative and complementary medicine.
Okay, and so for our listeners, Dr. Lisa is kindly going to give us a second program, so we'll separate these programs, and she will be talking to us about her specialty in working with cancer patients and her remedies, recipes, especially for those who are dealing with and struggling with cancer, that will help them help themselves in battling cancer. And before we get there, Dr. Lisa, could you please share with us, our listeners, of the history of naturopathic medicine? Where have we come from?
Yeah, and that's very interesting. Now, as you know, people have been practicing medicine, traditional medicine, for a long time. And when I say traditional, what I mean is medicine that's found near them. So it may be in the form of food, it may be in the form of herbals, it may be in the form of energetic medicine, laying hands on. So we can talk about even religion playing a role. And there's many psalms, for example, that people would repeat and over and over again to, for example, stop bleeding, etc. So there's all kinds of traditional or folk remedies that have been used for long periods of time. Mm-hmm. So the 16 and 1700s, you've got that kind of formulary, but the more conventional medicines began to form as we got more information, more research was done, invention of the microscope, the recognition that there's viruses and bacteria. However, as these conventional forms of medicine were forming, the traditional medicine still was very important and still continued to evolve. In the early 19th century, around actually the turn of the century to 1910 or 1920, the eclectics became a very, very important figure. So the eclectics were doctors who used homeopathic medicines and who relied on traditional medicine, but more in a formal state. So they prescribed tinctures, which are herbal formulations. They prescribed, as I mentioned before, homeopathics, etc. And there were schools. There was a large, pretty big, well-known school and hospital in Ohio, near Cleveland Hospital or Cleveland Clinic, where, you know, I was just talking about before that the oncology centers are the progressive centers for integrative health, but what has followed suit is that other clinics and other hospitals have very much integrated these complementary forms. But getting back to the history, the eclectics were very popular around the 1910s, 1920s. Then the American Medical Association, the AMA, began to become more formal. There began to be more medical schools, and those medical schools were based more on evidence-based medicine. And the evidence-based medicine was better funded and also a lot more formalized. And so as those schools increased and grew, there was skepticism that began to be shed on the eclectics and the use of traditional medicines. Most of the arguments said, well, that's not evidence-based medicine. We don't really know that that's working. That's hoo-ha. What does your grandmother know?
Yeah, what does she know?
Right, exactly. And we'll see what she knew. Mm-hmm. So as the years went on, even the public began to be more skeptical about the use of herbs, but there were definitely holdouts. And most of those holdouts came in the form of people who lived in rural areas or people that lived closer to the land.
Well, that's interesting.
Yes. And then you have, with the 1960s and 1970s, an awakening of people, of women's rights and civil rights. And with that became a recognition of Latinos and also Native Americans in their traditions. Mm-hmm. And so, the school that I graduated from, Bastyr University, was founded in 1982. And so that awakening started in the first graduating class graduated in 1982. And so that was founded in 1978 on the tail of this, the tail of this recognition. And but that wasn't the first school. The first school in North America was National College in Portland. So this reawakening, this recognition that the earth holds many, many, many remedies that people have been using for a long time. And so we saw a lot of pushback from the American Medical Association and conventional doctors, and based on this non-evidence base. But we also saw more and more people coming out of the woodwork saying, well, I use this and I use that. And we also see, again, more recognition of indigenous peoples in using the medicine. And as a result, a whole bunch happened from the 1990s through the present. We have the National Center for Complementary and Alternative Medicine, or NCAM, which was developed at the National Institutes of Health as a think tank, as a research center, as a funder for research for natural products. And why? Well, because 80% of the population, at least in the United States, uses some form of alternative medicine. This whole movement is not based on the dictates of the American Medical Society or Association. It's based on health consumers, what they want, what they use and what has worked for them.
Mm-hmm.
So,
Wow.
Yeah, and then we also see places like Stanford and the Cleveland Clinic and Dana-Farber Cancer Institute and University of Arizona Medical Center and Columbia. All of these places now have either dedicate some aspect of their medical training to CAM studies, or they actually have an integrated program at the hospital or at the clinic.
Oh, that is so wonderful.
Absolutely.
We have traveled such a long road, and a long, lonely road, I must add.
Oh, yeah. And if I may go back to what did our grandmothers know, our grandmothers knew that a tablespoon of cod liver oil in the morning or sometime during the day was really good for you. Did you ever take cod liver oil?
Yes, I have, from time to time.
Yes. And so now there's so much information, and it continues to be lots of research done on omega-3 fatty acids and how important those were to the body's immune function.
Mm-hmm.
So that Grandma knew that. Grandma knew that that adding molasses to food was good for your blood. So, okay, yeah, right, Grandma, that's good for my blood. Molasses has a lot of elemental iron and elemental calcium and magnesium and manganese in it that the body can use very, very readily. So Grandma knew that. Grandma knew a lot of other things that are now being researched. So I find it very interesting, but I'm so happy that these centers, many centers are actually integrating herbal therapies or Reiki, which is an energetic, or massage therapy, or even use of essential oils.
Mm-hmm. I was speaking with my wife recently, and we were talking about many of the experiences that we had, just our experiences alone, of going to traditional Western doctors who seem to be locked down within their specialty, or their eyes, nose, and throat. And our experience as we were talking, and said, oh, you know what? We had the sensation after walking away from some of these visits that they were lacking the whole picture. And the Western medicine seemed to be overly focused on the symptoms and not the causes of what is provoking. Why do I have allergies, for example, at this moment? So can you talk to this?
Yeah, actually, and thank you for that, because I want to go define what a naturopath is, and that's a good segue. So naturopaths, what are we? Naturopathic physicians or doctors are docs who go through 4 to 5 years of medical training. The first 2 years are about the same as you would see with a conventional doctor. But then the last 2 to 3 years, we have still some of the same training, but then we start, we also, our training also includes, the herbals, a little bit of massage therapy, a little bit of traditional Chinese medicine, some physical therapy as well. Our philosophy, what drives us is find the cause. Don't treat the symptom, but find the cause. And there's a little caveat there, is that we also, one of our other dictates is reduce suffering. So of course there will be times, many times, where we will try to reduce the symptoms, but at the same time try to go after the cause. Now, sometimes if somebody has scoliosis, which is curvature of the back, or some other mechanical or physical ailment that we can't correct, we know what the cause is, but the correction is something that we're not able to manage.
Mm-hmm.
But most of the time, for example, with GI symptoms, maybe irritable, leaky gut or irritable bowel or Crohn's or whatever, we try to find the instigating factor that's involved. Those were just some of the